Chiropractic therapy is a modern reinvention of the ancient art of spinal manipulation. In recent times, this practice has become steeped in controversy.
Much of modern chiropractic, unfortunately, has descended into the realm of quackery.
Universities are being accused of teaching pseudoscience.
It would be misleading to present that to students.
The results are really speaking for themselves. It comes down to the proof is in the pudding.
We've been coming for asthma.
A little bit of colic and reflux.
This has the medical fraternity up in arms.
Well, this is a great concern of the medical profession that there are some individuals taking their infants and young children to chiropractors.
It's even created factions within the chiropractic industry.
I am angered and I'm embarrassed for the profession.
Will chiropractors become the new family doctor? And are they putting our children at risk? Now, most people go to the chiropractor for back pain, and despite its surging popularity, its proven benefit is fairly limited. A review of spinal manipulation showed that it could alleviate acute lower back pain, but it was no more effective than heat therapy or even a good massage. Chiropractors have an important role in healthcare when it comes to treating musculoskeletal problems, but a new trend is emerging.
It's the move into paediatrics and the enormous number of chiropractors who are trying to set up paediatric clinics and claiming that they can cure a range of paediatric conditions that is really troublesome.
There have been reports that chiropractors are the new refuge for a range of health problems like asthma, colic, reflux and autism.
Last week, Jade had an asthma attack and I rang quickly and said, "Can you fit her in?" And they said, "Yeah, straight away." And we put her in and it stopped. Completely stopped.
Wow.
She was really, the full-on wheezing.
So if your girls get sick, do you take them to the GP or to the chiropractor first?
My first point of call is always the chiropractor. I didn't like to put drugs into their body if it wasn't necessary. So that's what I found with the GP, that they were very quick to just write a script and off they go. I didn't feel as if there was a lot of caring or individual care, at least, with the children.
Where babies used to be rare patients, they're now common in a number of clinics. Newborns and toddlers make up over a third of this chiropractor's client base.
Areas of subluxation that I can feel there that are immediately improved after you adjust it like that.
I would definitely send her along to the chiropractor first to see that we couldn't settle her first. I think her being a newborn, I think a nice way to approach it is to go as natural as possible and to give them care that's gentle and, I think that's more important than sending them along to a GP.
Were you surprised that they could treat a whole range of medical conditions?
Yeah, I've been very surprised because I wasn't really expecting the answer to be yes, to be able to sort out asthma.
I've witnessed myself and read reports of improvements in colic, bedwetting, asthma. There's a lot of word of mouth information that is going around the public that someone's child has been helped in that way, so they've come to the chiropractor process, they feel safe.
Now, you may be wondering how adjusting the spine could possibly help conditions that have nothing to do with the spine. Well, perhaps a brief history lesson may help explain where this came from. Chiropractic therapy was founded in 1895 by an American magnetic healer called D.D. Palmer. In his building worked a janitor who complained he was hard of hearing. D.D. Palmer decided to perform an adjustment on the man's spine, and in a miraculous feat claimed to have cured him of profound deafness. Palmer hypothesised that aligning the spine unblocked nerve flow through the body and restored the man's hearing. From this, he proposed that a misaligned spine was the cause of virtually all human ailments. Fast forward to today, and the Chiropractic Association still believes that curing deafness with spinal manipulation is plausible.
Well, it makes sense that that fella lifted something, he heard a pop in his back, and then he became deaf, and 17 years later DD did something and his hearing came back. It would suggest that there was a relationship there.
Between hearing and the spinal column?
Yeah. And there are nerve pathways that run from where he was supposed to have been adjusted up into the brainstem that can impact on function.
The brainstem.
John Cunningham, a spinal expert, disagrees.
There's no nerves that control hearing that have anything to do with the neck. They all come from the base of the skull, which simply cannot be influenced by any sort of spinal manipulation. I would have concerns over someone's appreciation of anatomy if they were to claim that the middle ear and the eustachian tube is affected in any way by a nerve that comes from the spine.
Tony Croak explains that even the slightest misalignment in the spine can act like a traffic jam in the central nervous system and lead to disease. In chiropractic circles, it's called a subluxation.
And so it's not necessarily that you have to compress the nerve root on the way out, but in fact the messages coming back in can be distorted because of that static in the nervous system travelling back upward.
It's just rubbish. If there is a static, well, why haven't they shown it? If that is the mechanism, they've had all these years to describe it, to document it, to study it, to perform experiments on it. Why haven't they?
Dr. Michael Vagg is a pain specialist and disagrees with the chiropractic theory about traffic jams in the central nervous system. During surgery, he deliberately scrambles the nerve signals to the spine so that patients can get pain relief.
We use spinal cord neuromodulators to electrically scramble the information that's going up and down the rear part of the spinal cord, and we see no evidence that that produces anything other than pain relief in most of our patients. So I think those observations are not consistent with the chiropractic view that optimum health depends on there being absolutely no interference with nerve function at all.
Paediatrician Michael Fay says the science doesn't stack up.
The idea that there are energy flows up and down the spine that cause disease in organs doesn't fit with our current understanding of science. There's been a number of systematic reviews which we examined chiropractic use for things like asthma, colic, bedwetting, ear infections, and don't show that there's any evidence that chiropractic is effective. If we look at the asthma trial, there's only been one done which has been conducted in a rigorous way, and they compared chiropractic therapy to a sham therapy. There was no change when they looked at the outcomes of respiratory function tests, the objective measures.
That's it. Let's get a bit of airflow.
Experts say quality research is lacking, even though patients swear by it. Therapies need to be tested in rigorous trials to remove bias and the placebo effect.
Do you think it could be placebo?
I bring focus to the fact that I want them to feel safe, and that one of the knock-on consequences of that, just as a side benefit, is that there may be a better placebo effect, that they might feel more confident and they might have a better outcome just because of that. I'm okay with that.
Chiropractors have relied on anecdotal evidence. And I think because of their fervent belief in what they do, that they disregard or put aside the scientific evidence, which shows that it's either ineffective or inconclusive.
And to the right.
John Reggers, a chiropractor, says he only treats musculoskeletal problems and that adjusting newborns is ridiculous.
Now you've got an infant, okay, that nervous system is not developed, its bony structure isn't fully developed, so I fail to see how anyone could find a problem with a 1-week-old baby by touching their spine. And therefore,
he says many paediatric conditions resolve spontaneously, like ear infections.
We know from all the literature that 80% of those children will be better within 5 to 7 days without any treatment. So if you take your baby to a chiropractor with a middle ear infection. He treats the baby gets better. Well, he's taking credit for it, and you also think that he's performed a miracle.
What concerns you the most about chiropractors treating very young babies?
I don't think the general chiropractor is trained well enough to actually diagnose problems with infants.
And herein lies the irony. The Chiropractic Association has announced a bold ambition to become the new family doctor.
So chiropractors really want to be the doctors of first choice?
It's a great idea.
Are chiropractors qualified to handle a whole range of medical complaints?
We're 5 years university trained, and that gives us the capacity to assess and then redirect. So, of course, if you need your tonsils taken out, I'm not your guy. If you need brain surgery, somebody else needs to help you with that. My job is to find and assess whether you need to be just with me, whether you need to be co-managed, or whether you need to be referred completely.
130. Not surprisingly, this aspiration has outraged the Medical Association.
The first point of care in the Australian health system needs to be your family doctor. A medically trained person who's comprehensively trained from cradle to grave to look at you and your family and the environment.
Is this a bad reflection on medicine that more and more people are turning to alternatives?
I think it is. Dissatisfaction with the quickie turnover turnstile medicine approach is a factor that drives people into the misguided hands of people who are doing the patient no good at all.
There is a lot wrong with mainstream medicine, but just because some planes crash doesn't mean that we should start using flying carpets. So you have to have a plausible alternative if there is a problem.
What's most disturbing about chiropractors being the first port of call in the health system is that many don't support vaccination, which is the most basic form of public health care. Chiropractors are the largest number of professionals that support one of Australia's most misleading anti-vaccination lobbies, of which Tony was a member.
I have been in the past, and I'm not now. And that was my reason for being involved, was to just access that data and have a look.
So what's your view after you've viewed the data?
My view is the same as the Chiropractors Association, that is that it's not what I do. People need to make an informed choice and need to chat to their GP about it.
Are you personally for or against vaccination?
I prefer not to. My own research and my own choices have been made, and that's personal to me. The Chiropractic Association does not deal with vaccinations. We're neutral.
Neutral is not good enough. If the Chiropractic Association takes some time, reads the evidence, they should conclude, just like everyone else, that there's a major benefit.
In this day and age, that is completely reprehensible. Vaccination is probably the most successful intervention in medicine, period. And not to have a position is intolerable.
In 2010, Sydney chiropractor Nimrod Weiner was reported for making false claims and inciting fear about vaccination. John Cunningham lodged a formal complaint to the Chiropractic Board.
Nimrod Weiner's website, I was concerned, had information on it that didn't represent the best available evidence with regards to immunisation. For example, one of the claims that he made was that vaccination actually causes sudden infant death syndrome, whereas the largest studies that have been done show that vaccination actually halves your risk of sudden infant death syndrome. He also claimed that vaccination causes autism, when in actual fact a large Danish study of over 500,000 children has proven without any shadow of a doubt that there is absolutely no link between vaccination and autism.
Nimrod Weiner declined to comment. The federal government appoints a regulatory board to preside over chiropractors. They enforce codes of conduct and ensure public safety. But the integrity of this regulator has been questioned over their failure to encourage that chiropractors support vaccination.
We're not here to promote clinical guidelines or those sort of clinical areas.
But you're supposed to be protecting the public.
We are, and where that has come to our attention as a notification, we've dealt with it satisfactorily.
But it seems in vain. This waiting room is full of misleading information. Here, a booklet by AVN. a widely discredited anti-vaccination group. This book suggests that parents delay their child's vaccination program and even recommends using scientifically unproven homeopathic vaccines as an alternative. Patients are enticed by celebrity endorsements and unscientific remedies. Websites are riddled with false information that chiropractic can help with conditions like autism, ADHD, even HIV. This from a profession that claims to be science-based, and yet it all appears to slip past the regulator.
Well, I don't know. We haven't been made aware that that's still the case.
So
we don't actually go out and look for it. The onus is on the public and members of the community to bring it to our attention.
How is the public meant to know whether or not the information they're receiving is correct to bring it to the board in the first place?
I don't particularly have the answers for that. We're very conscious of not over-regulating, but at the same time not under-regulating. We're trying to always maintain a right touch or a proportionate, what we call a proportional approach. But it is difficult. It's certainly a challenge, and I take your point.
But when it comes to coughing up money, it's the taxpayer that loses. Last year, the government spent over $10 million on Medicare rebates for chiropractic services. A quarter of that was for paediatrics. Professor John Dwyer says it's abusing the public purse.
Yes, absolutely. And that's why we wrote to the Health Minister asking her to have the Chief Medical Officer's review of what practices the government puts money into. And the answer was, no, we're not going to do that for chiropractic because we've got a National Registration Board which is going to protect the consumers. It palpably is not. Look at the chiropractic websites and you'll see just how determined and how penetrative this nonsense is.
This Sydney-based chiropractor claims to correct the length of a child's leg with a clicking device called an activator.
First we adjust the pelvis. No complaints there. And we get an instant lengthening, see?
I mean, what could you ask more? Just a few clicks and the child's chronic problem is fixed.
So how unscientific is that?
Well, it's totally unscientific. Obviously, when you're positioning a child on the bench like that, you can do anything with your legs. And then he moves the legs until they're equal. And the random clicking away from the buttocks to the upper spine with the instant results, this is what is so objectionable.
Various areas of muscle spasm around the vertebra there.
Well, it's interesting that the adjuster is then used on the neck, where there are no anatomical structures that, if you altered them in any way, would fix leg shortening.
Good, she's done. Easy. Here she comes.
If he does really believe that he's just cured a musculoskeletal problem that child had, a shortened leg, then that is really sad. That's really dangerous because, as Chekhov said, the quacks that are the most dangerous are the ones that really believe it.
There was a review of 8 trials involving the activator which showed it had benefit. But that paper also concluded that all the studies had poor design, small sample sizes, and no control groups. Now, you could argue that if parents want to spend their money on therapies that don't work, then that's their choice. But what if that therapy was causing harm?
There was a study published in 2011 which couldn't find a single significant adverse event in the care of children by chiropractors. Somewhere in the world in the last 20 plus years, someone would have said something that would have ended up in the medical literature, at least somebody somewhere. But to have a 0 result, that's pretty decent.
I think Tony could have looked a little harder in the literature because without a lot of difficulty I found a paper from 2007 in a very widely known journal called Paediatrics which documented some very serious adverse events, including 2 fatalities and including 20 delayed diagnosis of serious conditions like cancer and scoliosis, etc., where those people had been managed by chiropractors. So that's just one study. When one looks to the literature, you do find these things if you look hard enough.
The problem is chiropractors don't have a formal system in place for recording adverse events. The regulator concedes it's not ideal.
What currently exists is really a lack of hardcore data in terms of Is it or isn't it?
Well, why not establish a register to record adverse events?
Look, great idea, and I think that's something that was presented to the profession last year here, and there are certainly moves afoot now to sort of say, well, how do we do this and how do we set it up? And it's important to know, and it's a responsible thing to do for a profession.
The safety of manipulating a baby's spine has recently been brought into question. A 3-month-old baby was rushed here to Monash Medical Centre after allegedly having its neck broken from chiropractic therapy. Dr. Fay has confirmed this on X-ray, but says further details of the case cannot be disclosed due to ongoing legal action.
And it's not just a risk to babies.
When I got there, he sort of said, well, what's wrong with you? And I said, nothing. I'm just here for a tune-up, I think was the words that I used. And in hindsight, really, he should probably at that point have said, well, if there's nothing wrong with you, there's no reason for you to actually be here.
Yet he continued to perform a manipulation on you?
Yeah, on my back and my neck, yeah. There was no reason, there was nothing wrong with my neck, there was no pain in my neck. He then held my head with his 2 hands and lifted my head, it felt like he was lifting my head up, and tilted my chin and then cracked that way and then cracked that way.
Unfortunately, this was the result. Lucy's vertebral artery that runs down the side of her neck has been dissected. These neck manipulations are known to be risky.
Oh, gee, that's confronting to watch, isn't it?
It's the force of the thrust that is the thing that is believed to cause the injuries.
I literally couldn't move my neck to the left or the right. It was stuck. Yeah, and I was crying. I was incredibly distressed. I'm very tired today.
Lucy was fortunate she didn't have a stroke, but there was no way she was prepared for what lay ahead.
That sort of was the beginning of what's been now 3 years of pain management, treatments, diagnosis, testing, a lot of money, a lot of time, a lot of emotional energy. It's been a very difficult journey.
Lucy did sue for damages, but the legal bills became insurmountable, so she withdrew her case. Professor Dwyer, who co-founded Friends of Science in Medicine, says he wants universities to stop teaching chiropractic therapy.
I don't believe that there is sufficient science to warrant university education. I think they should get out of the chiropractic business. There simply isn't enough fundamental science in chiropractic to warrant a 5-year course. And I think the universities, by supplying these courses, give credibility. Those people would be much better off spending their time enrolling in a physiotherapy course and learning a whole lot of practical evidence-based skills. There's no place for chiropractic in a really strong academically based university.
Professor Peter Colo is the Pro-Vice-Chancellor at RMIT, where they teach chiropractic. He rejects the criticism.
We have a focus on strong evidence-based criteria, basic sciences, and we don't teach pseudoscience.
RMIT supplied me with lecture notes from the course, and I had Dr. Vag look over them.
There is inaccurate material that's been presented alongside material that's completely wrong, alongside material that's completely speculative, alongside some very sound anatomy. So if you're a student and you don't have the training or the background or the experience to tell what's what, then that I think is gravely concerning. Part of the responsibility of the university is to be a custodian of knowledge and a dispenser and a trainer of that knowledge. It's not to try and put things over the students in a way that leads them to come out of uni and then find out that they've been misled or that things have been misrepresented to them.
If that information can be documented, I'll take it back to the school and get them to look at it.
But what hope is there when a staff member actually believes the pseudoscience? We found a casual employee of RMIT making unsubstantiated claims on her website about autism.
Now, there's no evidence in the literature that chiropractic therapy can help with autism.
Agreed.
Are you not concerned that she may impart this pseudoscientific knowledge onto the students? They're very impressionable.
Students are impressionable, yes. If we bring external experts in, that they would come in to teach a particular area. We are not bringing someone in to teach things like the effect of chiropractic on autism.
It's a bad reflection on the university that RMIT graduates are going out there and practicing non-evidence-based techniques.
Well, our graduates, we don't control them once they go out.
When we approached Dr. Willis for comment, she deferred us to RMIT. The university did approach her, and she has since removed the claim from her website. In a surprise move, but one that is applauded by the medical profession. Sydney's Macquarie University has recently announced their plans to scrap its chiropractic course in a bid to remain focused on science. Meanwhile, the conflict within the chiropractic union is palpable, but John Reggers still believes he can champion change so that opposing sides of the profession can move into alignment.
We still have an opportunity to become spine specialists, non-surgical spine specialists. We have the skills and we have the training. And if we funnel our energies in towards that aim and that goal and disregard the extraneous things that are going on within the profession, then we will prosper.